Hey future nurses, welcome back to Smart Scrubs. I'm your fellow nurse and we are going to talk about acid-base imbalance today. Acid-base imbalances occur when the body's pH moves outside the normal range of 7.35 to 7.45. This shift happens when there are changes in either acid levels or base levels within the body. Even small deviations can interfere with cellular function, disrupt enzyme activity, and compromise the performance of vital organs. If left uncorrected or untreated, these imbalances can lead to life-threatening complications, which is why they are so important in nursing practice. For NCLEX preparation, acid-base balance is a high-yield topic. Questions often focus on respiratory and metabolic disturbances, as well as situations in critical care where rapid recognition and interventions are required. To master this concept, nurses need to understand the underlying pathophysiology, recognize the clinical signs and symptoms, and consider how electrolyte changes, such as alteration in potassium, interact with acid-base status. Equally important in applying nursing interventions, this include interrupting atrial blood gases, your ABG, providing appropriate respiratory support, managing fluid and electrolyte replacement, and anticipating provider orders for medication or treatments. By mastering acid-base balance, you will not only improve patient safety and outcome, but also strengthen your readiness for success on the NCLEX and in real-life nursing practices. Acid-base homeostasis refers to the body's ability to maintain a stable pH within the narrow range of 7.35 to 7.45. This balance is essential because even small deviations can disrupt enzyme activity, impair cellular metabolism, and compromise organ function, as I mentioned before. The human body maintains its pH within a very narrow and tightly regulated range of 7.35 to 7.45. This balance is critical for life because even slight deviations can have serious consequences. A stable pH is essential for enzyme activity. Like most enzymes only function properly within this narrow range, and any shift can slow down or stop important biochemical reactions. Oxygen transport is the second one. Hemoglobin's ability to bind and release oxygen depends on the pH of the blood. Even small changes can reduce oxygen delivery to tissues. Cellular function. Every cell relies on a stable internal environment. pH imbalances can disrupt electrolyte balance, energy production, and communication between cells. Because of this, the body has multiple overlapping systems like buffer systems, respiratory control, and renal regulation, working constantly to keep pH within safe limits. If the pH falls outside this range, whether too acidic or too alkaline or too basic, it can impair organ systems and quickly become life-threatening. That's why recognizing and correcting acid-base imbalances is a core responsibility in nursing practice. The lungs provide a rapid response in maintaining acid-base homeostasis. Their main role is to regulate the level of carbon dioxide in the blood. When carbon dioxide level rise, it combines with water to form carbonic acid, which lowers pH and makes the blood more acidic. When carbon dioxide levels fall, less carbonic acid is formed, raising pH and making the blood more alkaline. The lungs adjust pH through changes in ventilation. Increased breathing rate, hyperventilation, removes more carbon dioxide, reducing acidity. Decreased breathing rate, hypoventilation, retains carbon dioxide, increasing acidity. So our respiratory system is very helpful and it works around to maintain the pH value of our body. The system works within minutes, making the lungs the body's fastest mechanism for responding to pH imbalances, though it is more of a short-time or short-term regulator compared to the kidneys. The next is kidneys. The kidney act as the long-term regulator of acid-base homeostasis. Unlike the lungs, which respond quickly, the renal system work more slowly and taking hours to days, but it provides the most powerful and sustained control of blood pH. The kidneys helps regulate by adjusting bicarbonate level, reabsorbing bicarbonate back into the bloodstream when the body needs to neutralize the excess acid, excreting hydrogen ions. Hydrogen, it resemble acidity. So excreting hydrogen ions into the urine when there's too much acidity. So it try to reduce the acidity from the body. This dual action allows the kidney to restore balance and keep the pH within the normal range of 7.35 to 7.45. Renal regulation is especially important in chronic conditions such as kidney disease, metabolic acidosis, or prolonged vomiting, where the body relies on long-term compensation. Buffer systems are the body's first line of defense in maintaining pH stability. They act within seconds to neutralize excess acids or bases before larger regulatory systems like the lungs and kidneys step in. The most important buffer in the blood is the bicarbonate buffer system, which balances carbonic acid and bicarbonate to keep pH in range. Protein buffers, including hemoglobin, also play a role by binding hydrogen ions and minimizing pH shifts. All the buffer systems work quickly, they are limited in capacity. That's why they function in conjugation with respiratory and renal mechanism to ensure long-term acid-base homeostasis. Respiratory acidosis. Acid-base imbalances are classified into respiratory and metabolic types. Respiratory acidosis occurs from hyperventilation, leading to increased PaCO2 and decreased pH, commonly seen in COPD. Respiratory depression or neuromuscular disorders with symptoms such as confusion, drowsiness. Respiratory alkalosis results from hyperventilation, causing decreased PaCO2 and increased pH, often due to anxiety, pain, fever, or hypokalemia, and may present with lightheadedness, tingling, or seizure. Metabolic acidosis, on the other side, arises from excess acid or loss of bicarbonate, as in diabetic ketoacidosis, or renal failure, or lactic acidosis, or severe diarrhea, and is characterized by cusomal respirations, confusion, and arrhythmias. Metabolic alkalosis occurs when there is excess bicarbonate or acid loss, such as from vomiting, NG suction, NG tube suction, diuretics, or antacid overuse, and may lead to muscle cramps, tetany, hypoventilation, and dysrhythmia. So these are the signs you will see if people having respiratory acidosis or metabolic acidosis, or vice versa, or these would be the signs and symptoms. Metabolic acidosis develops when HCO3 decreases or hydrogen increases, leading to low pH. Common causes include diabetic ketoacidosis, renal failure, severe diarrhea, or lactic acidosis. The body compensates with deep, rapid breathing to blow off CO2, carbon dioxide, out of the body to reduce the acidosis level. As I mentioned before, carbon dioxide is equals to acid. So if there is less carbon dioxide in the body, means less acid. And symptoms include fatigue, confusion, hypertension, and arrhythmias. Recognizing these mechanisms is key in clinical care and NCLEX prep or NCLEX exam. Next is understanding respiratory acidosis. Respiratory acidosis happens when your PaCO2, carbon dioxide, the level of carbon dioxide rises above 45 mmHg due to hypoventilation. It means body is not throwing out carbon dioxide anymore, or less carbon dioxide, causing carbon dioxide retention in the body. This leads to increased carbonic acid and hydrogen ion concentration, lowering our blood pH below 7.35 Remember, 7.35 to 7.45 is the range that we need. Common causes include COPD. If someone is suffering from COPD, we will see this in them in their body. Pneumonia, opioid or sedative overdose. If you remember, opioid lead to respiratory depression. It means people are not they are not able to breathe, so they will have this issue. And neuromuscular disorders that impair breathing. Patients may show dyspnea, confusion, headache, drowsiness, and cyanosis as carbon dioxide buildup affects brain and oxygen delivery. The kidneys compensate by retaining bicarbonate, but this takes hours to days. As I mentioned before, the compensation by kidney takes time. Acute cases show a severe pH drop with little compensation, while chronic conditions like COPD often have near normal pH with high HCO3. Management focuses on treating the underlying cause and improving ventilation. Example, oxygen therapy, bronchodilators, reversal agents, or assisted ventilation. Always, if something like this happens, we want to focus on improving the underlying cause. Next, we're going to talk about understanding respiratory alkalosis. Respiratory alkalosis occurs when your PaCO2 falls below 35 mmHg due to hyperventilation, leading to decreased carbonic acid, and pH level will increase more than 7.45. Common causes could include anxiety, pain, fever, hypoxia, or overventilation from mechanical ventilation. Symptoms may include dizziness, lightheadedness, tingling in fingers or toes, palpitations, and sometimes tetany due to change in calcium binding. The kidneys compensate slowly by excreting bicarbonate to help normalize pH. Management focusing on addressing the underlying cause and, if needed, slowing the respiratory rate to restore CO2 levels to increase the acidic level in the body. The respiratory alkalosis occurs when, as I mentioned before, when PaCO2 is less than 35 mmHg due to hyperventilation causing decreased carbonic acid, and pH is more than 7.45. And the management, clinical signs, as I already mentioned, it's given on the screen. And the management strategies as well. Management of respiratory alkalosis involves treating the underlying causes. Always focus on treating underlying causes and providing the reassurance to an anxious patient, or adjusting the mechanical ventilation settings. Encouraging the patient to breathe into paper bag can help to retain carbon dioxide, and carbon dioxide is equals to acid. Next is metabolic acidosis. It occurs when bicarbonate decreases or hydrogen ion increases, leading to pH less than 7.35. Common causes include diabetic ketoacidosis, renal failure, lactic acidosis, and severe diarrhea. The body compensates with deep, rapid breathing to blow off carbon dioxide. Clinical signs include confusion, fatigue, hypotension, and potential life-threatening arrhythmias due to electrolyte imbalances, particularly hyperkalemia. And management focuses on treating the underlying causes, as always, and correcting electrolytes and supporting respiratory functions. And the same thing that I already mentioned. The primary cause of metabolic alkalosis include prolonged vomiting, which result in significant loss of stomach acid, and the use of diuretic, which can lead to loss of potassium and hydrogen ions. Other causes may include excessive bicarbonate administration or certain hormonal imbalances. Clinical signs, it could be muscle cramps, dizziness, and potentially tetany due to decreased ionized calcium levels. Neuromuscular excitability increases, leading to symptoms like tingling, spasm, muscle spasm, which are important signs for healthcare provider to monitor. Okay, metabolic acidosis and hyperkalemia, how those two things are related. In metabolic acidosis, excess hydrogen ions move into cells, causing the potassium to shift out to maintain electrical balances. This leads to hyperkalemia, which can cause arrhythmias and other cardiac complications as the sodium-potassium pump struggles to maintain proper gradients. I also posted a video about electrolyte imbalance and sodium-potassium pump if you want to go and check those. It will really help in this to connect this whole situation with electrolytes. The other one is metabolic alkalosis and hypokalemia. In metabolic alkalosis, hydrogen ions are lost, so potassium shifts into cells, resulting in hypokalemia. This can impair the sodium-potassium pump, prolong cardiac action potential, and increase the risk of arrhythmias. Monitoring potassium levels is essential in both conditions to prevent complication. If you remember, potassium is the most important electrolyte for cardiac function. Acid-base disturbances can affect multiple organ systems, as I already mentioned in the beginning. Neurologically, acidosis may cause confusion, lethargy, while alkalosis increase neurological excitability, leading to tetany or seizures. Cardiovascularly, potassium shifts can cause arrhythmias and alter myocardial contractility. Respiratory compensations may strain muscles, causing fatigue or respiratory failure. Musculoskeletal effects include weakness in acidosis and cramping in alkalosis. Chronic imbalances may impair renal function. Continuous monitoring of ABG, electrolytes, and clinical signs is essential for preventing complications and guiding the treatment. So nursing intervention, respiratory acidosis, nursing interventions is improve ventilation, administer oxygen, use BiPAP or CPAP, or assist with intubation if necessary. Treat underlying causes, as I already mentioned several times. In this whole acid-base situation, we want to focus on treating underlying causes, because if you keep providing the solution, if you keep administering oxygen, if you keep giving them what they need to manage for that short time, it's only going to work for that certain time, but that's not the long-term solution. So we want to focus on treating underlying causes, like manage infections, adjust sedative or opioids, and support airway clearance. We want to check respiratory rate. We want to monitor our patient, and to do that, we want to check their rest rate, their oxygen saturation, ABG, and neurological status for signs of confusion or drowsiness. We usually do the neurological assessments on those patients who are suffering from acid-base imbalance. We want to position patient upright to ease the breathing, so high Fowler position, and encourage effective coughing or deep breathing exercise as tolerated. So yeah, address the underlying cause, such as anxiety or hypoxia, why they are in this situation. Encourage the rebreathing techniques, like using the paper bag, and monitor neurological signs for symptoms like tetany or seizures, as well as respiratory rate. And metabolic acidosis management, treat the underlying causes, again, by administering insulin or DKA, and we want to give them fluids for HCO3 loss, and consider we want to administer the potassium supplements and provide IV fluids as needed. Check potassium levels, muscle strength, and ECG for arrhythmias or weakness. When it comes to potassium, as I mentioned before, potassium is really important electrolyte for cardiac functionality. So we want to put a monitor beside the patient's bed to monitor their ECG. And we want to educate patient on dietary potassium and ensure safe mobilization to prevent falls or injuries from muscle weakness. Okay, if we want to talk about NCLEX, what we want to focus about acid-base imbalance when it comes to NCLEX exam. Mastering acid-base imbalances is essential for NCLEX success. Focus on understanding the pathophysiology, recognizing the clinical signs. So you can create a cheat sheet, you can create a flashcard with two different differentiating symptoms for acid and base, for alkalosis and acidosis, and linking the electrolyte shifts like potassium changes to patient outcome. This knowledge supports both exam readiness and safe, effective patient care in clinical practice. So that's all for acid-base imbalance. If you have any question about this whole situation, please post it in comments. And if you have any recommendation or if you want another video on any different topic, please post it in comments. Thank you so much. Have a good one. Bye.